Welcome everyone to our Community Update COVID-19 program. My name is José Madrigal and I am the Durango City Manager. With the recent increases in COVID-19, we felt it was appropriate to resume broadcasts of this program to update you on the local situation. We invite you to stay tuned to DGov, Durango's Facebook page, and elsewhere to look for updates as we progress through these uncertain times. Before our discussion begins, I want to thank Diane Jenkins, our American Sign Language interpreter. She is provided to us by the Colorado Rural Interpreter Services Project. At the November 17th Durango City Council meeting, the City Council considered creating a mandatory mask zone for downtown. The City Council had a healthy discussion which included an update to the public on the new COVID-19 guidelines that take effect as part of the new Dial Red Severe Risk. At the conclusion of this meeting, the City Council directed the staff to look at a more comprehensive approach that encompassed the whole city and bring back a recommended ordinance for consideration on Monday. With us, via a virtual connection so we can maintain social distancing, is Liane Jollon, Executive Director of San Juan Basin Public Health. Thank you for joining me today, Leanne. I wanted to have a quick conversation about recent changes in our community. As you know, we were about 250 total cases for quite some time. That's obviously changed. What are some of the factors influencing those numbers?
Great. Well, thank you for having me. And this is really important that we get this information out to the community at this time. So March through September, March through the end of October, the total cases for La Plata County was about 425. Since the beginning of November, we have experienced over 450 cases. So to say that again, we had less than 50% of our cases March through October 31st, and we've had more than 50% of our cases in the last 2.5 weeks here in La Plata County. So what's changed is that all over the US, there are states that are surging in cases. Colorado is unfortunately in the leading edge of that. We are out of 50 states. Our case rate across the state of Colorado is about 13th from the top. So that is an extraordinarily high number of cases in the state of Colorado, which means that our community is having a very difficult time staying insulated from this trend. What we believe is happening is we have been successful at social distancing and reducing transmission here in this community and across Colorado because we were able to conduct a lot of our activities outdoors. Our Safer at Home order for the state of Colorado, in fact, was called Safer at Home in the vast, great outdoors. We no longer have the same opportunity to spend time together outside as we move into winter months. And we are inside together more often while there is more prevalence of disease in the community. And we are relaxing about our transmission control measures because for a period of time, this wasn't creating increased spread. It is now, and we have seen this huge number of cases in our community.
Thank you, Leanne. Well, that transitions very well to our next question. With the Thanksgiving holidays coming up next week, can you briefly describe the changes our community can expect with the new Dial Level Red Severe Risk?
So we are one of over 50 counties in the state of Colorado that have more than 350 cases per 100,000 residents over 14 days. So this measure was put in place this fall by public health professionals across the state. The number 350 cases per 100,000 residents over 14 days was the number that was determined by the modeling available to the state of Colorado, which would indicate that we had case growth that was on a trajectory to outpace availability of healthcare. So when you hit that measure, your community is a severe risk community, meaning that you are at severe risk for outpacing the accessibility and availability of healthcare in your community. So there are 50-something counties in this risk level right now in the state of Colorado. we as a community are moving into a higher level of restrictions so that we can change this trajectory for our community. What this means to individuals is we are asking you to limit your personal gatherings over the next 14 days. We have also put into place additional restrictions for our businesses. This reduces capacity at many businesses down from 25% to 10%. This applies to businesses, workplaces. It significantly restricts organized events. And unfortunately, it creates a very difficult situation for our restaurants and our gyms. Restaurants are asked to go to takeout, delivery only, or outdoor seating if there's an opportunity for winter outdoor seating. And our gyms also have further restrictions. So that's what it's going to look like in this community for the next 2 weeks. We believe that if we all work together to follow these restrictions, we can avoid next steps for this community, which are further limiting to what we can do together as community members.
Thank you, Leanne. So kind of feeding off of that if we're able to take these steps in the next 2 weeks, we may be able to avoid a stay-at-home order, correct?
That is absolutely what we are looking for from this community, yes.
Thank you. And also, how can community members inform San Juan Basin Public Health of potential non-compliance concerns?
There are 2 ways to do this. You can call a non-emergency dispatch to report a concern in progress. The other way that you can do this is there is a portal on San Juan Basin Public Health's website. I think the easiest way to find it is to put into the search San Juan Basin Public Health complaint, COVID complaints, and that will take you to a form that is distributed to local law enforcement in the jurisdiction where this violation occurs. And we work together, local public health and local law enforcement, to work with the community for outreach, for education, and to assist businesses, workplaces, and organized events in how to operate safely so that they can operate without spreading infection.
Thank you, Leanne, for your time. I know you're extremely busy, and thank you for the vital updates. We value our partnership with San Juan Basin Public Health, and we look forward to speaking to you again. And now I have a couple quick City of Durango specific updates. As of Monday, November 16th, the cashier window at City Hall is closed from 11 a.m. to 12 p.m., Mondays through Fridays. The Durango Public Library has returned to curbside-only service, which will be available Tuesdays through Saturdays, 10 a.m. to 4 p.m. To request items and arrange a time for pickup, call 970-375-3380 or email reference@durangogov.org. The Durango Transit bus stop located at the Walmart parking lot has been relocated to the southwest corner of the building on Dominguez Way. For more details and to view a map of the new location, please visit durangogov.org/transit. And for all service changes due to the public health order updates, please visit durangogov.org/emergency. And with that, I just want to thank you, Durango, for joining us. It's important that we all follow the new guidelines so that we can keep our local businesses open and our friends and family healthy. Thank you.